Good evening. I'm Dr. Annette Kusmal, a medical officer with the Centers for Medicare and Medicaid Services here in Kansas City. Tonight, Darcy and I will be presenting an update of CMS incentive programs and other news. Here's an overview of the CMS incentive programs that we will be discussing. The Physician Quality Reporting System, which used to be known as the Physician Quality Reporting Initiative, the e-prescribing incentive program. This includes both incentives and a payment adjustment, and the electronic health record incentive program. We're going to be focusing primarily on the 2011 programs, meaning what you can do now, and I'll be addressing the first two topics. Physician quality reporting started in 2007. Eligible professionals, meaning physicians and other professionals paid under the physician fee schedule, who satisfactorily report data for covered fee schedule services provided to Medicare Part B patients, will qualify to earn an incentive payment. For 2011, the incentive is 1% of the total estimated Part B fee schedule allowed charges for covered services provided during the reporting period. For the years 2012 to 2014, the incentives are 0.5% per year, with a payment adjustment beginning in 2015. There are a large selection of measures from which to choose. Eligible professionals can report on at least 3 individual measures or a measures group, which is a group of related measures which is relevant to your practice and your patients. There was an option to report data as part of a large or small group practice. Now, the deadline to sign up for that as a group practice has passed, so I will not be discussing that in detail. Physicians that report to PQRS and also participate in a maintenance of certification program may be eligible to receive a larger incentive payment. Eligible professionals can report by Medicare Part B claims via a qualified electronic health record. They can report via a qualified registry, or again by group practice reporting if they've signed up for it. This incentive is independent of participation in other incentive programs. For individual eligible professionals, there is no notification or registration. You can simply start reporting. The CMS website includes a How to Get Started page. What you'll do is you'll review the list of quality measures, and you'll select possible measures related to clinical conditions that you usually treat or your clinical setting. Then you'll review the specifications for these measures, and you'll select at least 3 to report on. Alternatively, you can report on a measures group. Then you'll ensure that your practice identifies all of the patients that are eligible for at least 3 measures, and you'll report their quality data information using the appropriate CPT2 and G codes. Now, we suggest that you then watch your remittance advice for the code N365. This code indicates that the submitted quality data code passed into the national claims history for future processing for the physician quality reporting. Again, that's code N365. That'll be on the remittance advice. to say that the data code moved to the National Claims History. Please note that this does not mean that you have submitted the correct quality data code. Those who choose to report by a registry or electronic health record need to use one that is qualified. There are lists of qualified registries and electronic health records on the CMS website, and these lists are updated each year. For reporting by claims, CMS requires that eligible professionals report quality data codes for at least 50% of the eligible patients for each measure. For reporting by a qualified registry or EHR, the reporting expectation is higher, that you report on at least 80% of the eligible patients. There is also the option for a 6-month reporting period in the physician quality reporting system if you decide to begin reporting in July. If you are successful in the 6-month reporting in 2011, your 1% incentive would be based on the total estimated allowed charges for covered services provided during the 6-month period. And here are the key dates for the 2011 physician quality reporting. All claims must be received by the end of February 2012. As a reminder, you cannot resubmit claims just to add the quality data code. If you're submitting data by a registry, electronic health record, or the group practice reporting, this must be in by the end of March 2012. The maintenance of certification information must also be received by the end of March 2012. And again, please see the CMS website for more information about qualified registries, electronic health records, and the maintenance of certification. There is a lot of information on the CMS website, including the measure specifications, and very importantly, the phone number and email address of our help desk.